we have a number of investigations we can use. The easiest one that is radiation-free ultrasound. For the coronary circulation, that is very important, and we just talked about it now as a risk factor for heart muscle disease. The circulation is deep in the chest, so it's very difficult for the ultrasound probe to get clear images of the coronary arteries. Therefore, what we rely on for early disease is to scan the carotid circulation. Carotid circulation is in the neck here, and when the arteries come to the angle of the mandible, the carotid artery bifurcates into two branches. One goes inside the skull to the brain, the other outside the skull to the scalp. So as soon as we put the probe in the neck, you have a very clear cross-section of the carotid artery, which demonstrates the thickness of the innermost wall of the carotid artery. Imagine we are talking about a fraction of a millimeter, and you can accurately measure it. Thickening of that part is the earliest manifestation of atherosclerosis, even before plaque formation. Then, of course, patients with advanced disease will have plaques all over the place, and you can measure them. Even they might have obstruction of one of the arteries. But we are talking about early detection here. So, in summary, carotid ultrasound scan is very simple. It doesn't take more than 5 minutes job and will provide clear evidence for early disease. I must mention a very important trial run in Sweden called VIP Visa. And that trial looked at a large population of 30,000 individuals. They classified them into two groups. One group were allowed to look at their carotid scan before they put them on risk factor control. And the other group did not have that chance. And that trial proved clearly that patients and GPs who had the carotid scan results in front of them were persuaded significantly to adhere to very, very strict lifestyle control as well as risk factor control. And of course, what you expect, better outcome. The second important investigation is CT scanning of the coronary circulation. And this helps in measuring something called coronary calcium score, which means the extent of calcification of the coronary arteries, which again represent hardening of the arteries, one, and also calcification is a form of atherosclerosis, whether it's clinical or subclinical, it doesn't matter. But as long as it's there, it's telling us that there is an ongoing pathology. We have published lots of papers on this subject, in fact, and we found out that patients with coronary artery calcifications, if you put them on statins and you control the risk factors, the calcium score might increase further. But it does not increase because of worsening of disease, but it increases because of further stabilization of the pathology. And fibrosis, if you like, and the calcification of the inflamed wall of the coronary arteries, which is great, was associated with great outcome in terms of events, heart attacks, angina, and hospital admission. So these are the two most important imaging investigations that assess detecting early disease of the coronary or carotid circulation. Someone might ask also a question whether the two pathologies in the carotid and the coronary arteries are related or not, since the two techniques are looking at different things. They are related, of course, not very closely, but once atherosclerosis is well established in our body, you are very likely to find it affecting the two circulations.